Magandang gabi sa inyong lahat and welcome po to another edition of Agapay, Tatak Rosa Rosal, where we bring you a certain brand of medical program that brings medical conditions that are common and uncommon to your screen. And ngayong araw na ito is a very important day because I have with me back from our first episode ever ng Agapay is Dr. Joseph Lee, our celebrity urologist and a very, very good friend of mine, Doc Joseph. Thank you very much for finding time in your busy schedule na mapagbigyan itong programa namin ngayon.
Of course, thank you, Buddy William, for the generous introduction. It is always a pleasure of mine to be part of your Agapay episodes.
Yes, and you've known my lola also.
Exactly.
No? So talaga, it's para bang talagang ako, gusto ko para tayong pamilya
the
dito.
The philanthropist, the beautiful Rosa Rosal.
Okay.
My gosh.
Okay, Doc, ang pag-uusapan, of course ngayon, no, pag-usapan muna natin yung evolution mo as a doctor. Kasi,
evolution
oo
talaga?
Naman, kasi dati, how many years ago? 13, 14 years
parang
ago.
Parang feeling mo dinosaur. Evolution talaga.
Hindi, evolution as a professional. Because dati
okay.
kasi, diba, I remember nung when we started talking, you were with Fatima. And I know you're still with Fatima,
yes.
but now you're with many others and yung para bang you have clinics everywhere, which is a good thing because maraming maseserbisyohan na tao.
Okay, so a very short evolution.
Yes.
All right.
Kung saan na tayo ngayon.
Okay, so 25 years in the practice of urology and endourology, and I've already branched out to sexual aesthetic for the longest. No?
Which is one of the pioneers. That's why I wanted to talk to you about that because if not the only one, kung tutuusin right now.
And you're one of the brand ambassadors. You know that. You know that. Actually, very interestingly, William, 25 years is quite a long time, but a fabulous opportunities and service to our kababayans with regards to my profession, which is urology. Okay, there are a lot of things already evolving, especially for some of our common disease. Like we've talked about how we manage some very common ones, like urinary tract infection,
Yes, which is the very basic for both male and female, actually. Yeah.
Enlarged prostate, kidney problems that would go from kidney stones, infection, to kidney mass. No?
Yes, and finally to renal failure.
Yes, and then we have our cancer, from testicular, bladder cancer, then prostate cancer, which we will discuss.
So basically, Doc, napaka-broad nitong natin, nung topic and field natin, di ba?
So beyond that, what is very interesting, William, now is the concern more of the general welfare and awareness and wellness of male in totality. When you talk about male in totality, Will, it's not just like, oh, I go to the clinic, I just have this one problem and have it treated and managed, and that's it.
Okay.
Now, I think men are, yes, exactly what you're saying. Men are more concerned as a whole. And generally, as what we're saying, they are more, in principle, concerned with ageless.
Right. Or being functional.
Men's longevity, not physically only, not physical, but also in the reproductive sense.
Yes, na para bang kailangan na you are functional for as long as you are alive. Parang ganon. Na mawawala na yun, functionality ng function na yun, kung kayo ay nawala na sa mundo.
True.
And ngayon, this is a very, very good news, no? Para bang, and comforting for most men that this is now possible.
Yes.
Because mahirap the male, I think the male sexual reproductive system rather is very complex. It's different from the female. The
it's
female,
also unique, Will.
It's also unique. Okay, sige, mamaya pag-uusapan natin sa our third gap, yan, pagiging unique na yan. Kasi meron kami nga na pag-usapan off-cam na talagang nagbago yung flow ng aking episode today supposed to be. But going back to the original, let's talk about prostate cancer, Doc Joseph, because sa totoo lang, marami pang hindi nakaka-recognize. There are many people who still do not understand kung ano ba itong prostate na ito. Can you introduce the prostate gland in its most general form po?
I agree with you, Will. Either they don't really understand or they don't want to look into the possibility of how the state of their prostate is. No? Like what you're saying, the prostate is a very important male reproductive structure.
Right.
That is an internal organ. It's always an internal organ. It's not external, because sometimes they mistake, it's part of the testicles and everything.
Yes. Totoo. No. That's very true. Very true.
Okay.
That's what I wanted clarity on. It's not. Hindi mo makikita ang prostate. There is absolutely no way you can see it.
Exactly. And when you examine, the prostate, it is internal to the anal canal.
Doon. Ano siya? It's called digital rectal
examination.
Or yun.
You know that. So you know that it's an internal organ.
Yes.
So it is just a squeeze between the urinary bladder above, superior. Then alongside you have your pelvic muscles, and there is a tract that is within the prostate, which is your urethra.
Okay. So kumbaga, it is not even close to the testicles. It's actually not quite, di ba?
No, it's more close to the
pantog.
Rectal bulb. To the pantog,
yes.
into the pantog.
Okay, di ba? Mas doon nga. Yes. Doon nga. So para bang kung titingnan mo siya, mas connected pa nga siya sa urinary than the actual testicle. Kaya iimportante kasi yan because like anything else, as we grow older and sometimes meron genetic or mana-mana sa pamilya, no, nagkakaroon din itong problema. And this is a very, kumbaga, hindi natin kasi, di ba, when we talk about organs, ano ba ang front and center? Kidney, baga, puso, di ba? At saka atay. These are the ones that take front and center along with yung puso natin. Pero there are other things, di ba? Like, ayan nga, the prostate gland, which is yung parabang needs maintenance and prevention just as much. Lalong-lalo na pagka nagkakaedad ang isang lalaki.
So, like what you said, Will, it's a chestnut structure.
How big is it,
a little smaller to our fists. A little
so
smaller.
Malaki rin siya.
Oo, a little smaller, but it should be roughly in weight size around 20 to 25 grams.
Okay.
It's a grammer. Now, then what is important, basically, it's the production of seminal fluid.
Oh,
okay. You have to remember.
I didn't know that. Seriously, did not know that.
So you have to know, Will, that our semen comprise of the seminal fluid, which is produced by the prostate, plus your sperm cell.
Wait, your sperm is ang testicle. Yun ang alam ko.
Right.
So yung pala, so yung fluid, so ganito ang pagkakaintindi ko. Yung sperm which is produced by the testicle is carried by the seminal fluid that is produced by the prostate.
Yes.
Okay,
so,
ayun.
in the process of, excitement and all those stuff and sexual consummation.
Yes, also related to orgasm.
Yes, and they will join together. And once it comes out as semen, you have the seminal fluid plus the sperm cell.
I see. So they work together.
Yes.
That is why, ito po ang reason, ating mga kaibigan, no, kung bakit ang prostate ay actually parte ng reproductive system.
And you have to take note, William, the prostate takes in a lot of nutrients. And not only that, it have fructose, it has sufficient of minerals like your zinc, selenium, magnesium, and a bunch of vitamin E.
So high maintenance din ang prostate kung tutuusin.
Yes, but no, because it's something that is very important for the male reproductive system, right? Reproductive, because that is where once it connects with the sperm cell, it is the nutrient form of the sperm cell at that point that it passes through the tract of the female. Diba? During its journey, so may food siyang element coming from the seminal fluid. You get what I mean?
Yes.
Parang siyang di ba yung mga astronauts, they have this packs
right.
They bring to the to the atmosphere and before they have their journey and all those stuff. So it's like this also. So that's very, very important. Not people. A lot of people will say, it's just there, it's staying there, very quiet.
But
or
it's
whatever.
actually a very important organ. Okay. And Doc, eto kung sasabihin natin ang prostate health, just very briefly before we go on a break, ano yung masasabi natin kailangan ng prostate gland natin to maintain a good prostate health? Ang alam ko, I mean, from my stock knowledge, sopalmeto is one of them. Yun ang pagkaalam ko lang.
Because structurally and histologically, Will, the prostate, not only does it produce significantly our seminal fluid, it is glandular and muscular in nature.
Okay.
So the Sopal method that is taken by some of our kababayan acts on the glandular. When you say glandular, the hormones,
hormone-related.
Hormones like the testosterone, it's hormone-related.
Okay.
The muscle, the smooth muscles of the prostate is the contraction aspect. So this is the sexual aspect. So when it contracts, the seminal fluid comes out.
I see.
Diba?
Like a sponge.
Not
Pagka when you squeeze the sponge, then the fluid, the liquids will come.
Exactly.
I see.
And the glandular aspect tends to be on the the maleness
Oh, okay.
aspect
I
because
see, I
of
see.
the
Right.
hormones.
So it covers one part of the function and
Yes.
not necessarily the beat
Exactly.
and all. Okay. Ayan, Mali, we have a lot pa to talk about. So, magbabalik po ang aming programang Agapay, Tatak Rosa Rosal makalipas lamang ng ilang paalala. Don't go away.
"2025 was a meaningful year for Bingo Plus Foundation. As our purpose grew, it was time for a new chapter. Introducing DigiPlus Foundation.
Education is the bridge to opportunities. Through the Future Smart program, we empower learners and educators nationwide. At DigiPlus Foundation, we multiply learning for a better future.
Healthcare should come with no barriers. Kalusugan Plus delivers medical missions, and Embrace Plus mental health support, which empower every Filipino through compassionate and accessible healthcare. At DigiPlus Foundation, we multiply healing. One patient, one community at a time.
Every dream deserves a chance. In Wish Plus, we grant wishes, empowering individuals, families, and communities together with their partners. At DigiPlus Foundation, we multiply hope, dignity, and possibilities.
Disasters don't wait. Through the Bayanihan Plus program, we mobilize immediate response and recovery efforts. At DigiPlus Foundation, we multiply the spirit of Bayanihan across the nation.
DigiPlus Foundation is committed to delivering on our promise to bring help within everyone's reach. When support becomes accessible, impact doesn't just grow, it multiplies.
Madaling pa ba mag-cash in sa Bingo Plus?
Sa Bingo Plus,
Official partner na namin ng Bayad Center. Easy!
license ba yun ng popcorn? Sa Bingo Plus,
Kaya responsible gaming lagi.
ang fun!
Gaming? Na may insurance?
Sa Bingo Plus,
Sa PhilFirst, insured ang wallet mo ng 1 million pesos.
Safe nga! Talaga namang...
sa Bingo Plus,
Partnered with Bayad Center, licensed by PAGCOR, protected by PhilFirst.
sa Bingo Plus.
The best players succeed because they set boundaries. Every great athlete wins with control. Always have a game plan.
Good day, everyone. I am William Thio, and I am inviting you to watch the PCSO lottery draws that we air 3 times a day, every single day. We not only play for fun, not only for winnings, but most importantly, for charity. So let us always remember, play smart, play safe, and most importantly, play responsibly.
We want Dubai to be number 1. That's the vision. Back then, it seemed like a desert dream. But we had brothers who believed that our desert is a land of endless opportunities, who believe nothing is impossible to a willing heart. The Filipinos. And so they came, the best and the brightest, with the will and the skill to build the biggest and the tallest. Shukran, brother Filipinos. Your hearts and your minds help give life to our Dubai dreams.
I am Chris. I am the Philippines.
Mabuhay Pilipinas and hello world! This is Tracy Perez, and if you're looking for that one sign to bet on yourself, and change your life? Then look no more! Kami na po dito sa PCSO Lottery Draw ang bahala sa inyo. Nandito po kami araw-araw. Yes, you heard that right. Every single day, walang palya po kaming magpapasaya sa bawat Pilipino. So catch us live on IBC 13, D8TV, and on our official social media channels. That's every 2 p.m., 5 p.m., and 9 p.m. Sama-sama tayong mangangarap, sama-sama tayong magtatagumpay. See you there, mga kalaro!
Welcome back to Agapay, Tatak Rosa Rosal, and still with my very special guest, Dr. Joseph Lee.
Yes.
And one of the pioneers in sexual aesthetics, di ba? Ayun na, Doc, pag-usapan, we were talking about the prostate, and ngayon naman, hindi naman, not yet there, pero kasi since alam na natin yung basic health ng prostate, ngayon naman, let's talk about the common problems na pwedeng mangyari sa prostate. And cancer is the apex, tama?
Yes, exactly.
Okay, so ano yung, let's build up. Ano yung the general pinaka-minor muna?
Okay. The three important clinical condition which we commonly see in our clinics and in the hospital setting for prostate is enlargement, or you call that BPH, or benign prostatic hyperplasia. Hyperplasia is a pathological term for increasing the cells of the prostate, right? Then two, you have prostate cancer, for which it is already ranked within the top 10, of cancer for men in the Philippines.
Age 40 and above.
No, 50. We have 40s already.
Yes.
But this is in general.
Because
we have lung cancer, colon cancer for men.
Pero within the 10.
Within the 10.
And to think that hindi pa nga siya kilala, marami pa ngang hindi alam kung ano yan,
Exactly,
di ba? Tapos,
correct.
It's in the top 10.
I think roughly it's ranking around top 5 na siya, di ba?
Okay.
Beyond lung cancer, colon cancer, colonic cancer, colorectal and pancreatic and prostate cancer. So this is for the men. So for general, it's still in the top 10 because you have also your this is between two genders, no, male and female. Because you have breast cancer, colon cancer, lung cancer, and I think it's within the top 10, around 7 or 8.
I see. So, ang katumbas ng breast cancer sa lalaki is technically prostate cancer. Because breast is endemic halos sa babae and prostate sa lalaki.
And breast cancer involves hormones. Likewise, your
prostate
also involves hormones.
So that is where the similarity ends actually, di ba? So, eto, Dr.
And prostatitis.
Prostatitis.
We were already talking about the prostate cancer. But so you have enlargement, cancer, and prostatitis, which is very common, as what you were saying.
Ano ang prostatitis?
Infection of the prostate.
Oh, I see. And that's very curable.
Unless you manage to see your doctors and follow up and very well go for your treatment modalities, because your prostatitis can go from chronic, subchronic, chronic, and your more severe form of
in a very short time. Okay, so kumbaga yung progression niya is very fast. Okay, Doc, how will you know na may problema ang prostate ng isang lalaki? At saka paano ito ano yung mga managements natin para dito?
Okay, if you considered obstructive symptoms, when you say obstructive symptoms, frequency, dysuria, intermittency, and you have a feeling of retention and all those stuff. And worst comes to worst, if you're talking about or you're thinking about tumors, you have hematuria, blood in the urine.
Okay.
So blood and urine can branch from, is it infection, severe infection? 2, is it stones? And worst comes to worst is cancer, right? Either is from the bladder or from the prostate. And since we're talking about the prostate, you can have hematuria plus all the symptoms that are interrelated with enlargement of the prostate.
Hala,
The same thing.
So in other words, it's really very complicated. It's hard to zero in. So the best advice is seek your doctor's help.
Yes,
talaga,
evaluation, like what you're saying a while ago, digital rectal examination.
And then yung PSA.
PSA, ultrasound, try to see if there are hypoechoic areas. Hypoechoic areas, these are non-radiographic noted imaging in the prostate that is centered on the prostate. You will see that this could be suspicious for prostate or prostate lesions.
Okay.
Plus your PSA should not go beyond 10 nanograms per ml. That's 10 because normally it should be 0 to 4.
I see.
Alright, so
anything
beyond 10,
near 4, anything is high, pero between 4 and 10, hindi naman siya directly sasabihin na CA na siya.
Hindi. But we have to be careful, Will, because we have already PSA elevated at around 6 or 8 that we catch. You were asking about the age bracket. We catch this on some of our patients now around 40 to 50 who has early stage of prostate cancer.
Wow.
So that our generation now, we're finding now earlier stages of cancer on earlier age group.
Oh, I see. Just like, kumbaga, we see obesity in children, we see cardio concerns in younger people. Hindi naman ito
because of lifestyle.
Because of lifestyle. And that's a very good point, Doc. Because of lifestyle. As a matter of fact, maraming mga problema na ito ay pinapanganak or nangyayari. Di ba? Actually nagkakaroon ng problem because of lifestyle. We cannot discount that, di ba?
Yes,
Ibang-iba yung lifestyle ng mga bata ngayon kaysa mga panahon natin.
Exactly. Because now, food lifestyle is kind of a lot of fast food, processed food.
Instant process.
No, nothing that is organic. Nobody, I think, is already cooking.
Right.
Like you cook, you prepare your food.
No, actually, I don't. Because I'm also guilty of that, no? Because,
but you're very conscious.
But
no, buddy, for the longest, you're very conscious on that. But what we're saying that even if you don't prepare, but
yes,
you're conscious
tama.
about that.
I'm conscious of that because why? Because nakikita talaga natin, and luckily with my job, with your job, we know the consequences of these foods that look real but then they're not.
Exactly.
There's so many synthetic things going around, and para bang I guess we cannot begin to actually para bang explain or yung para bang put pressure on how bad this is for our
especially
bodies.
Those that are a lot of fries, a lot of grilled.
Okay.
And less are not eating the steam ones, which is good.
Which is actually steam is
and the
one of the
microwave
best,
oven
diba?
Foods are problematic also.
Right, because they involve radiation
Exactly.
and so much of other things, di ba? Which is masama na nga yung kinakain mo to begin with, masama pa ang pagka-prepare. The process, di ba? Or kung halimbawa, andyan dilata. Although, naiintindihan natin yung ating mga kababayan because ngayon, napansin ko even with me, sa sobrang busy ng mga schedules natin at marami tayong ginagawa, wala nang time to have breakfast, lunch, and dinner. Aminin mo, we eat when we have time.
Yes, and this is very nice, no? I'll explain to you, buddy. Because you would be asking me why is the age pattern going within 40 to 50, and when theoretically we talked about 50, 60, 70 years old, you get to catch people with prostate cancer. Because nowadays, number one risk factor major is the stress. Elevation of stress and anxiety.
There's a factor also in this.
Yes. So when you have a lot of stress, you have a lot of antioxidants roaming around, and it involves and get into the problem or into the cells of your prostate glands. And you have to remember, if you have a family history, genetic history, and the familial tendency, the genome, the genes that is purveyor of cancer might be plucked out. When you say pluck out, might be stimulated,
I see.
and that begins the process of this is a pathological word.
Yes, yes.
Dysplasia, meaning deformity of the cells, dysplasia,
Okay.
and then they become actual cancer cells.
So para bang kung ako, no, because I'm not a doctor, I always go back to being a kid. So you can explain it like para bang kumbaga in a very simple term, it's like it's hibernating. Kumbaga it's not active, but because of stress and anxiety, it could actually activate these sleeping cells na hindi naman dapat mangyari to an active cancer cell. At saka once nagkaroon na kumbaga once na nagising ito, there's no way to stop it already. Magigising na siya at gigisingin na niya lahat ng mga na.
Exactly. That is why that is what you're explaining is in terms of
children's books.
Yeah, no, but that's true because you have a familial tendency. That's why familial is hereditary.
Yes.
When you talk about hereditary will, that's genetic.
Yes. Sa tatay mo, sa lolo mo.
If it doesn't show now, then you always ask your doctor, why after 10 years I become a cancer patient? Because you try to see your environment. Is there a lot of stress, a lot of problem, or if your lifestyle is in a more problematic way, either food or exposure to chemical.
Right,
you know?
right. That's a big factor, right?
And we had a lot of device gadgets that are also problematic soon.
Okay.
Yeah,
when we are exposed to these gadgets and the radiation.
Exactly. Okay. So this will trigger our genes, our genomes to emerge, like what you say, like a child book. The sleeping cells or the sleeping cancer cells might
go into full bloom.
Full bloom.
Okay. And once it's there, so Doc, ito no, kung alimbawa we have prostate cancer, let's just say nandito na po tayo, ano yung mga simptoma nito?
Okay, then you get to have the more complex one, which is bleeding.
Okay.
Lower back pain.
Okay, pagka may bleeding, remember, I think this is a golden rule for anything and everything. If there is bleeding, definitely something is not right.
Yes.
Tama?
You don't bleed unless you menstruate.
Tama. Right. Exactly. Or hindi. Or sometimes kung mainit na mainit, sometimes you will have a bleeding nose. But halos yun lang
this is more urinal.
Yes,
meaning you urinate blood.
Right,
There's blood tinge. Then you have to go. You have to go and.
This is a red flag.
Yeah.
You need to have it checked.
You have it checked. Then you go for PSA. I know it's difficult for some to have their PSA checked, but you have to. So once
it's your responsibility sa sarili mo.
Yeah. So once you have elevated PSA, then you have to undergo either elevation beyond 10, biopsy. Do a biopsy. Now biopsy has evolved from local biopsy, transrectal biopsy, to MRI assisted biopsy.
Okay.
You call that Artemis, and you have now coming in. The last time I went abroad, you have robotic biopsies already.
So, and we have this in the country.
Robotic yet? Not yet.
Pero yung Artemis meron. I know because this is one of the ones in your clinic that I saw in the box, ha? So I saw in the box.
Yes.
Sabi mo pa nga sa akin, kailangan malamigan ito. The aircon has to be very strong. So, hindi. But with all things aside, at least meron ways to...
There is ways to detect. But of course, we always say, Will, that after detection, you have to prepare yourself for the announcement of whatever will come as the result. Now, whatever, meaning how do we go about and stage our cancer? Gleason's, histological, you count the numbers.
Or the stage.
And now you have PIRADS.
Okay.
PIRADS is how is the stage conforming to the possibility of later metastasis. So
yun.
this is a new thing now.
That's very, very Very good, because it's not, and I didn't know that. So para bang you have to study the situation at hand. You cannot just generalize, tama?
Before kasi ano, we had discussion, Will, it's like, oh sige, you do biopsy, I will tell you your cancer. That's it.
Yeah. Now hindi. You have to understand the movement of
Right,
the cancer.
the movement and the
behavior,
and you will know that the possibility of how in the next 5 years it will move,
right,
and the possibility of it going into a metastatic lesion,
which is ang dami-dami ng cancer, parte ng katawan na maapektuhan. So ayan, pag-uusapan natin yan sa ating third part
the
dito
most
po.
critical.
The most critical, and then we will transition to something a little bit more sabihin mo more niche, kung baga. Okay?
Yeah.
Sige, don't go away after these messages. Our program, Agapay, Tatak Rosa Rosal, will be right back.
Magandang araw po sa inyong lahat. Ako po si Mary De Leon, ang inyong PCSO Lotto host, inviting you to watch the Philippine Charity Sweepstakes Lotto Draws. Live na live po namin binubola ang inyong paboritong Lotto games araw-araw. That is every 2 p.m., 5 p.m., and 9 p.m. Kaya siguradong transparent, exciting at kapanapanabik ang bawat draw at mapapanood ito sa DATV, sa Facebook, and on YouTube. Kaya naman, huwag kalimutang tumutok at sumali dahil baka kayo na ang susunod na maging Lotto Milyonaryo. Pero higit pa sa pagkakataong manalo, alam nyo ba na sa bawat taya ninyo ay maraming buhay ang natutulungan? Ang bawat tiket na inyong binibili ay may katumbas na tulong para sa mga pasyenteng nangangailangan ng medical assistance, para sa mga programang pangkalusugan, at para sa iba't ibang serbisyong nabibigay pag-asa. Kaya habang kayo ay nangangarap na manalo, nakakatulong pa kayo sa kapwa Pilipino. Isang simpleng taya, isang malaking pagkakataon. Hindi lang para sa inyo, kundi para sa ating mga kababayan. Kaya ano pang hinihintay ninyo? Taya na! Tumutok na at sabay-sabay nating abangan ang susunod na panalo. Muli, ako po si Mary De Leon at ito ang PCSO Lotto para sa pangarap mo at para sa bayan. Good luck at sana kayo na ang susunod na manalo.
Hi mga ka-D8! Sa panibagong episode ng Alam Mo Dapat, pag-uusapan natin ang Department of Migrant Workers o DMW, ang tinaguriang tahanan ng mga OFW para sa mga Pilipinong nagtatrabaho sa iba't ibang panig ng mundo. Kasama natin ngayon si Assistant Secretary Attorney Jules Ambito Fermin ng DMW para sagutin ang ating mga katanungan. Good afternoon po.
Yes, magandang hapon, Miss Joanna, at sa inyo po mga taga-subaybay.
Ano naman po yung pinakamalaking hamon na kinakaharap ng mga OFW natin ngayon at paano ito tinutugunan ng DMW?
Masasabi natin pinaka-mabigat na hamon, syempre mapalayo sa pamilya at ang lalo na sa ngayon sa tension na kinakaharap natin, yung uncertainty kumbaga.
Yes.
So kami po pinanatili po namin bukas ang tahanan, meron po tayong ginagawang mga virtual conferences to check on our workers at sa pamamagitan po ng ating Migrant Workers Office ay they're doing welfare check po, pumupunta po mismo sila kung saan ang kumpanya ng ating mga trabahador ng ating mga migranteng Pilipino at syempre andyan po ang ating mga digital platform. So they could reach us through the Kabayan Kumusta app, Meron po tayong digital platform, meron din po tayong Facebook page. In fact, all our migrant workers offices also have their separate official pages. So they
ano
could
po ulit ito,
contact them.
Kabayan?
Kumusta Kabayan app.
Kumusta Kabayan app? Very Pinoy.
Yes, kumusta ka?
Baka may mensahe lang po kayo para sa ating mga OFW at kanilang pamilya.
Ayan, sa atin pong mga OFW, no, hindi po tumitigil ang pamahalaan sa pamamagitan po ng Department of Migrant Workers. Narito po lagi bukas ang iyong tahanan para po kayo ay gabayan, tulungan at bigyan ng kagyat na suporta po. Ganon din po ang iyong pamilya. Okay, so wag po kayo mag-alala, hindi po kayo nag-iisa. Saan man kayong sulok ng mundo, ang DMW po andito at gagabay po parati sa inyo.
Huwag kalimutang i-follow ang DATV, DATV News at ang DMW para sa iba pang balita at impormasyon tungkol sa mga serbisyong pampubliko. Ako po muli si Joanna Luna, mag-ingat po tayong lahat. Alam mo dapat.
Hello, Lotto players. My name is Ashley Tuason, one of the hosts of the PCSO Lottery Draw. And our show is all about fun, excitement, and luck as you play your favorite digit games. But aside from that, our show is also giving back to the community, especially to different sectors of our community through our charitable programs. And if you are watching or if you love watching our show, this might be your lucky day because you might be the next Lotto millionaire. And you can watch us every day at 2 p.m., 5 p.m., and 9 p.m. only at DATV. Once again, my name is Ashley Tuason, one of the hosts of the PCSO Lottery Draw.
Nagbabalik po ang aming programang Agapay, Tatak Rosa Rosal. And then, Doc, no, we came off from the other segment talking about yung para bang metastasize. Because when cancer metastasize, it means that it spreads to the rest of the body, which is, this is already advanced in a sense na mahirap na itong i-contain, di ba? Dahil hindi na tayo localized, kumbaga.
Exactly. You know, when we diagnose, like what we have explained, it's not just diagnosing the cancer because you know for the fact the adenocarcinoma type is more common, right? You stage, you diagnose, then you more or less predict the survival rate. When you say survival, how the patient, how the patient will be after 5 years and another 5 years. That's very important. Then
and quality of life.
And quality of life. Now we have now patients who even are under treatment, on treatment, then there is resurgence. So it's already metastatic and reoccurrence of a treated metastatic patient.
So
you get what I know?
Yes. So para bang if it has metastasized and then it hibernates again and then it resurfaces again and then we treat it again and see what other parts of the body that it has further damage or spread to.
These are the ones, Will, that are very, very strategically important because this is more like what you explained are systemic already. So what when you say systemic, it's like it has gone into the other organs, and treatment modality is minimal for you to choose. Okay,
I see.
So our treatment goes from like we have. I think we can explain to them. Oral medications, hormonal medications, surgical management. When you say surgical, you have the open, right?
Yeah.
And it has innovated from
Invasive.
laparoscopic to robotics.
Right.
Then you have your brachytherapy. You put radioactive seeds. Okay. In other countries, you put cryotherapy. you freeze you refreeze them, like you bring them back to their sleeping state, right? Then what is now common is immunotherapy,
which is actually yung parabang the best that we can do, di ba?
and
Kung
this
expensive
this,
ito
will, because this one already manipulates the gene pattern. That's why immunotherapy.
So,
remember the ones that we were explaining a while ago?
Yes. So in other words, buddy, etong immunotherapy is the closest thing that we can get to curing cancer. Tama?
Yes.
This is the closest. It's not a cure.
And it's not a cure, but in order to obviate the metastatic recurrence effect.
Kumbaga para hintuin or at least delay, di ba?
Or yung survival mo 10 years or more.
So can we say na para bang if you have been diagnosed with cancer, kasi syempre in my time, lalong-lalo na nung bata pa ako, I would hear my parents talk, hear my grandparents talk, it's chemotherapy and that's it.
Yeah,
at
that's
the time.
because chemotherapy, radiotherapy. Now you have immunotherapy.
Yes, now you have many. So can we say that cancer survivors are getting more
choices?
Mas dumadami at saka mas tumatagal ang buhay, mas nagkakaroon ng quality ng buhay na maayos kaysa sa nandun ka lang sa bedridden or waiting for yourself to expire.
Agree to the fact that because you have more choices. Agree to for which if you do follow up and you don't miss your tests, your battery of tests, even after diagnosis, I think your survival will go beyond your
prescribed time. So actually what we want to do, I think if I understand correctly, when a person is diagnosed with cancer, we want to catch it. Ito para sa ating para sana maintindihan ng ating mga manonood, no? We want to catch it at an early stage.
Yes.
Because
the better survival.
Better survival at an early stage. Before that, if we can prevent it, it's better para hindi na tayo umabot. Much better. Again, like everything. An ounce of prevention is worth pounds.
But you have to remember, Will, it doesn't remove your cancer.
Yes,
the only thing that you don't let it propagate, like what you say.
Hindi na siya kakalat pa or magiging worse. Because ngayon, naiintindihan ko how we want to handle cancers. Parang, I'm trying to understand if this is correct, it's like how we handle hypertension and diabetes, which is hindi na talaga nawawala. Once may diabetes ka, di ba? It's management
sometimes you got funny feeling that why constantly you're hypertensive but you're not cured? Because it's difficult to really, treat something that goes up and down. And you have some of your system and some of your hormonal system that tends to take effect on your blood pressure.
Right. Exactly. Because yung para bang ganun. So para bang, again, maintenance. So through this cryotherapy, immunotherapy, ito naman ang nagiging maintenance factor ng cancer patient. Tama? And yung functionality ba ng isang patient, nakakatulong din itong mga bagong teknolohiya na ito?
Of course, one of you're asking especially erection, right?
Yes, especially kasi di ba, like we were talking about it, one of the biggest concerns of male patients is when they finally, let's say you're in a position where you need to operate on your prostate, ang nagiging consequence yan is hindi ka na erectile dysfunction, and many men don't want to have that. That's why they try to delay or try to find out meron pa bang ibang solusyon.
Yeah. There are treatments that will take effect on your erection physiology, which is your effect. We do have that. But of course, like what we say, you have to look at the higher costs.
Yes.
Meaning to treat your cancer. And the other one, we just have other managed men's modality that we can do, right? Besides medication, we have non-invasive treatment for erection that we
Yes.
Yeah, like what we have in our
In the
center.
Kaya lang, you have to do it regularly. Again, walang miracle. Ay, mga ibang tao kasi, pati hair transplant, iniisip nila after hair transplant, tapos na yun. Hindi, may maintenance yun.
They have to grow. The hair have to grow.
The hair
right?
has to grow. And you also have to take care of the native hairs na hindi nakatransplant.
Yes,
So,
exactly.
ganun din ito. It becomes part of your integrated lifestyle. Tama, Doc?
Agree. So, I think what is most important is the genetic interplay and the prevention of external factors, or like you always hear about antioxidants, radicals, antioxidants that will eliminate radical cells. No, the radical cells are the ones that are very, very significant in changing the mood or structure of the cells from what we were talking about ago to dysplastic to anaplastic, from a more disformative cells to a more cancer cells.
I see.
This becomes vicious. So we don't want that to happen.
Umabot. Wag na tayong umabot sa ganyan.
What na umabot kasi you elevate the stage. And I will reiterate, Will, because like in our time now, stress is the number one
cause
indicator of cancer.
Cancer. So in other words, do not ignore that and do not just bypass it.
Exactly.
Na para bang iniisip na wala yun, ganun. Lalo na sa generation natin, Doc, we are so used to stress, sa totoo lang. But anyway, actually, kaya dinefer ko ito nga next topic natin is because I want to have another episode for sexual aesthetics, ha?
Yes.
Kaya ipa-plug ko na siya ngayon. Kaya very, very soon. Yan naman ang pag-uusapan
that
natin.
Is interesting.
That's interesting, and I believe it needs its own episode. So, at this point, Doc, any final words para po sa ating mga manonood to take better care of themselves? Yan po ang advocacy ko, is that please take care of yourself because you only have one body. Isang katawan lang po ito, di ba? Lahat kayo takot mamatay, pero hindi nyo naman ginagawa yung mga bagay-bagay na dapat gawin para magkaroon kayo ng isang mahabang dekalidad na buhay.
Wow, okay.
Diba?
No, first and foremost, of course, I'd like to thank you, Will, and Agapay for inviting me again and to choosing this topic. This topic has not been a run-out-of-the-mill topic, paulit-ulit. You always talk about prostate cancer, but we have to put it in our audience mind that even though it's a repeated topic of prostate cancer, but significantly, there are still increasing cases.
Yes.
So that makes the topic more juicy in the future.
Yes,
right?
tama. And
very interesting.
Yung passion and hunger to find a cure.
Exactly. So, like Will is saying that don't underestimate prostate cancer. That's number one. Second, there is a cure because we have a lot of modalities for you to choose and for you to discuss with your doctor. Number three, of course, after which is very important, just in case that you are diagnosed, don't despair because just follow up. And I think you still will have a very good life after because it's not really that detrimental.
You still have a quality of life.
Right, the quality, correct, no? Then four, just remember that we are specialists, are here to help and preserve and to keep your men's health in tip-top shape.
Okay. Doc, last, where can they reach you if they have any questions and your clinic hours and the best place kung saan sila pwedeng pumunta?
Okay, so regularly they can visit me at Urology Center of the Philippines. That is in Quezon City. That is where we do a lot of our important and innovative stuff. Okay. Then I have a new one. It's a male hub in Binyan, Rejuvenative and Aesthetic Wellness Center. Later on, we'll discuss the aesthetic aspect of it.
And what this hub offers.
And I have several hospitals that you can go. If in Manava, you can go to Fatima. Then you can go to Manila Doctors. Then Health Cube, Healthway, Army General. and the rest goes on.
Okay, yes. And Health Cube, for me, Health Cube is the most, wala naman sa I'm not really promoting anything. But for those...
Artistic.
Yes. At saka, if you want to go to a clinic that doesn't look like a clinic, para hindi ka ma-stress, Health Cube would probably be for beginners, kung baga. It's like a play school.
The show.
Yes, the one in Shaw Boulevard. Yes, my lola used to go there for therapy also at some point. So, thank you very much, Dr. Joseph Lee. Kaya nga hindi na ako nagbigay ng title because there's too many. It will take up my episode. Okay? So, maraming salamat for shedding light. Yes, until the next episode. Marami pa tayong pag-uusapan. But magpapaalam na muna po ako ngayon sa ngalan po ni Rosa Rosal, where we try to bring a certain brand of medical service po para sa inyo later on as the show evolves. Also, I would like to be able to give medication, vitamins or something to people who are needing of it, of course. So until next episode, nagpapasalamat na po. Have a nice evening to everybody.